with my colleague Joss. So Joss, during jiu-jitsu, suffers from, so you might call it crook neck, so here we'd call it cervical facetal pain or thoracic facetal pain, which is where the joints in your neck can become a bit jammed and uncomfortable. There's a couple of techniques that we would like to use at the clinic to help with this, to help to mobilise. So the first thing I can do is I can take my hand and sweep it underneath Joss's neck, and then from here, I'm going to grip onto the transverse processes of the neck. So I can be quite specific with this. I can also get quite low down to focus where I want the articulation to go. Now from here, I can then just tuck my head, or tuck Josh's head, sorry, into my shoulder. And now I've got quite a lot of control of his neck, but as I fixed above, I just need to fix below. So I'll just take my hand and push down the first rib, and now I've got quite a lot of focused tension on the cervical thoracic area. So how does that feel for you, Josh?
Yeah, feels good.
So from here, obviously you see side bending, so me just opening up the left hand side of his neck, which is where the problem is. But from here I can start to sweep my elbow under, and I can add some rotation in as well, and it should feel quite strong quite quickly.
Yep.
Good stuff. So a lot of the time I'll just ask the patient to breathe in and out with my movement, just to help them to relax, but also as well as that, just to use the ribs as further leverage. And I can just feel that mobilising between my hands. I could then turn that into more of a soft tissue technique, which is where I'll grip the attachment of the scalenes, and then I'll start to pull the insertion and origin away from each other. So I'll just show you on this side as well. So from here, transverse process of the neck, here, so articulation would be here, soft tissue mobilisation would be here. But then as well as that, for pain relief, we just want to add in a manipulation as well. So I'm just going to place my hand on the articular pillar of the neck on this hand side. Just ask Joss to tuck his chin in. And then want to add the levers together. From here, if I use pure rotation, it's going to be too uncomfortable. So I'm going to add some different levers in. So it will be, so from here, so a slight anterior shift, side bend to the left, rotate, feel it starts to tighten up already. We're going to add a little bit more, bit of flexion, side bend, rotation. And then from there, we can just open up that joint, just gets a nice clip, it feels better, and then we'll continue with the strengthening exercises.